And more now on the statement from the White House physician updating the president's condition and his treatment so far. Health reporter Stephanie Stahl is here with that update. Hi, Stephanie.
Well, Jessica, the White House doctor says the president remains fatigued but in good spirits and adds the First Lady is well with only a mild cough and headache. And the statement did reveal the president is getting treatment for the virus. The memo says as a precautionary measure, the president received a single 8-gram dose of Regeneron's polyclonal antibody cocktail. That's an IV given to boost the immune system. The president is also being treated with zinc, vitamin D, famotidine, that's an antacid, also melatonin and aspirin. Here is the last time we heard from the president last night.
We'll see what happens. I mean, who knows?
President Donald Trump sounded congested in a phone interview hours before announcing his positive COVID-19 test results. The 74-year-old president is at risk for complications because of his age and being obese. According to the CDC, 8 out of 10 COVID-related deaths in the United States have been among adults age 65 and older.
And most people who have a serious infection tend to be older, but most older people still recover completely from this infection.
The White House says the president and First Lady have mild symptoms for which there are no treatments.
There's no reason that he couldn't take phone calls or conduct virtual meetings.
Dr. Eric Sachemwala, an infectious disease expert at Einstein Medical Center in Philadelphia, says a fever and difficulty breathing are indications the virus is becoming more dangerous and a threat to the lungs. If the president were to develop these more serious complications, what's the time frame for that?
We usually see that within the first week.
The White House is doing contact tracing, especially for people who were on Air Force One, because the virus is more easily spread by people without masks who are in close contact for a period of time.
From the time when they're exposed to the time they develop symptoms, it's about 4 to 6 days.
And the virus can be spread before symptoms appear, even when tests are negative. So what about the supporters who were with the president in Bedminster, New Jersey for an event on Thursday, and he was in Harrisburg on Saturday?
I think the people that were at those events need to potentially, be evaluated.
Also, doctors say anyone who has direct contact with someone who tests positive for COVID-19 is supposed to self-quarantine for 14 days. Jessica?
All right, Stephanie, thank you.